Hello, my name is Dr. Maria Dizon. I'm the Chief of Services for our elderly care, skilled nursing medicine, and the memory clinic here at Kaiser Permanente, Central Valley area. So the video that we will be presenting to you today will tackle a very important disease called Alzheimer's disease. This is very important because of our aging population, and currently there are actually more than 5 million Americans affected by Alzheimer's dementia, and 1 in 3 of our senior citizens actually die of Alzheimer's disease or any other form of dementia. It is the 6th leading cause of mortality currently in the US, and actually, believe it or not, it tops prostate and breast cancer mortality combined. So it's really very important that we learn about this very important disease. So the video that will be presented by Alzheimer's Association will talk about the early stages of dementia, the early clues that we can detect, because unfortunately we still don't have any cure for Alzheimer's disease up to this point. So we are very proud to be partnering with Alzheimer's Association, and they are a great resource for our patients and caregivers for this very important disease. So I hope you will find this video educational and informational. Thank you.
Hello, my name is Denise Davis with the Alzheimer's Association, and I'd like to thank Dr. Dizon for that warm welcome. I know that we would all like to be together in person for the Stanislaus Healthy Aging and Fall Prevention Summit. I'm so grateful that we can bring this series together virtually this year. Today, I'd like to share with you a brief introduction to Alzheimer's disease. Today, we'll be reviewing normal aging versus dementia, Alzheimer's and dementia, and what are the differences, and we'll discuss risk factors. Alzheimer's is a progressive disease of the brain that causes a slow decline in memory, thinking, and reasoning skills, and more than 5 million Americans are living with Alzheimer's. Dementia is a general term used to describe a decline in cognitive functioning, and Alzheimer's disease is the most common form of dementia. Other forms of dementia include Lewy body dementia, vascular dementia, and frontotemporal degeneration. Alzheimer's disease is the 6th leading cause of death in the United States. 1 in 3 seniors dies with Alzheimer's or another dementia, and it kills more than breast cancer and prostate cancer combined. Let's test our knowledge a little bit, and I'm going to ask you a couple of questions next. Alzheimer's disease is a normal part of the aging process. Is that a true statement or false? So the answer is false. Again, as I mentioned before, Alzheimer's is a brain disease that causes problems with memory and thinking and behavior, and it is not a normal part of aging. Our second question today is, what is the greatest known risk factor for Alzheimer's disease? Is it genetics, family history, or age? And the answer to this question is age. Although Alzheimer's, again, is not a normal part of aging, age is the greatest risk factor for the disease. After age 65, the risk of Alzheimer's doubles every 5 years. 32% of people 85 and older have Alzheimer's. Hispanics are about 1.5 times as likely as whites to develop Alzheimer's and other dementias. African Americans are about twice as likely, and almost 2/3 of Americans living with Alzheimer's are women. Now, we'll go over warning signs. There are 10 warning signs and symptoms. If you notice any of them, don't ignore them. Schedule an appointment with your doctor. The first warning sign that I'll cover today is memory loss that disrupts daily life. One of the most common signs of Alzheimer's disease, especially in the early stage, is forgetting recently learned information. Others include forgetting important dates or events, asking for the same questions over and over, and increasingly needing to rely on memory aids, such as reminder notes or electronic devices. What's a typical age-related change? Sometimes forgetting names or appointments, but remembering them later on. Warning sign number 2 was challenges in planning or solving problems. Some people living with dementia may experience changes in their ability to develop and follow a plan or work with numbers. They may have trouble following a familiar recipe or keeping track of monthly bills. They may have difficulty concentrating and taking much longer to do things than they did before. A typical age-related change here is making occasional errors when managing finances or household bills. Warning sign number 3 is difficulty completing familiar tasks. People with Alzheimer's often find it hard to complete daily tasks. Sometimes they may have trouble driving to a familiar location, organizing a grocery list, or remembering the rules of a favorite game. A typical age-related change is occasionally needing help to use maybe microwave settings or to record a TV show. Warning sign number 4 is confusion with time or place. Persons living with Alzheimer's can lose track of dates, seasons, and even the passage of time. They may have trouble understanding something if it's not happening immediately. Sometimes they may forget where or how they got there. What's a typical age-related change here is getting confused about the day of the week, but figuring it out later. Warning sign number 5 is trouble understanding visual images and spatial relationships. For some people, having vision problems is a sign of Alzheimer's. This may lead to difficulty with balance or trouble reading. They may have problems with judging distance and determining color or contrast, which can cause issues with driving. What's a typical age-related change here? Maybe there are vision changes that are related to cataracts. Warning sign number 6 is new problems with words and speaking or writing. Persons living with Alzheimer's may have difficulty following or joining conversation. They may stop in the middle of conversation and have no idea how to continue, or they may repeat themselves. They may have struggles with vocabulary, have trouble naming a familiar object, or even using the wrong name. What's another typical age-related change? Sometimes having trouble finding the right word. Warning sign number 7 is misplacing things and losing the ability to retrace steps. A person living with Alzheimer's may put things in unusual places. They may lose things and be able to go back over their steps to find them again. They may accuse others of stealing, especially as the disease progresses. A typical age-related change here is misplacing things from time to time, but having the capability to retrace those steps to find them again. Warning sign number 8 is decreased or poor judgment. Individuals may experience changes in judgment or decision-making. For example, they may use poor judgment when dealing with money, or pay less attention to grooming or keeping themselves clean. A typical age-related change here is maybe making a bad decision or mistake once in a while. An example may be neglecting to change the oil in the car. Warning sign number 9 is withdrawal from work or social activities. A person living with Alzheimer's disease may experience changes in the ability to hold or follow a conversation, and as a result, they may have withdrawal from hobbies or social activities or other engagements. They may have trouble keeping up with favorite team or activity. A typical age-related change may be sometimes feeling uninterested in family visits or social obligations. Warning sign number 10 is changes in mood and personality. Individuals living with Alzheimer's may experience mood and personality changes. They can become confused, suspicious, or anxious. This may be easily upset at home, with friends, or when out of their comfort zone. And developing a typical age-related change here is developing very specific ways of doing things and becoming irritable when routine is disrupted. So it is possible for individuals to experience one or more of these signs in varying degrees. And it's not necessary to experience every sign in order to raise concern. If you notice one or more signs in yourself or another person, it's important to visit with your doctor. You can also visit our website at alz.org/signs, as you see on the screen here, to learn more about the 10 signs of Alzheimer's. With early detection, you can explore treatments that may provide some relief of symptoms and help you maintain a level of independence longer, as well as increase your chances of participating in clinical drug trials that will help advance research. Now I'd like to briefly talk about the Alzheimer's Association resources and our programs and services. The Alzheimer's Association leads the way to end Alzheimer's and all other dementias by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. And we provide support and services and match that mission through many of the services that I'll share with you now. And these are our key resources. We're available whenever and wherever you are and provide reliable support and information. Over the phone, we have our 24-hour helpline that's available every single day, all day, at that toll-free phone number that's on your screen now. And again, that's 1-800-272-3900. And we provide guidance and support through our clinical level staff. We also provide care consultations. We have a very robust website at the website on the screen there, which is at alz.org. And on our website, we have wonderful resources such as our community resource finder, the Alzheimer's Navigator, which provides just a wealth of information around community resources and support. We have an ALZ Connected, which is our free online message board community for all persons who are affected by Alzheimer's or another dementia. We have a wonderful caregiver center that has topics such as caregiver stress and a caregiver stress check, which and also changes to your relationship and grief and loss as the cognitive impairment changes. We also have a safety center that has topics including home safety and dementia and driving. We provide support groups for the individual with a diagnosis and also their care partner or their family member, and provide some wonderful education programs as well. And you can, again, find all that information at our website at alz.org. And all of the information that I've mentioned today is provided in multiple languages. And thankfully, even with the situation that we have right now with COVID, we've been able to really be able to provide all of those resources that I mentioned virtually, just like I'm doing today. We'd love you to get involved in the way that we have all of these resources and all of these programs and services. One of our annual fundraising events is called the Walk to End Alzheimer's. And this year, our fundraising event was like no other. We had an interactive event. This year, our event, the Walk to End Alzheimer's, took place in Modesto on September the 12th. We also had the Walk to End Alzheimer's in Sacramento, which took place on September the 26th. And just this last weekend, we had our Walk to End Alzheimer's, our fundraiser, on October the 3rd. And upcoming is our next Walk to End Alzheimer's in Stockton on October the 17th. And these Walks to End Alzheimer's not only help us to raise awareness and raise funds for Alzheimer's and all other forms of dementia by providing these programs and services to all of our communities. We receive a lot of our funds from personal contributions and including the Walk to End Alzheimer's. So I would encourage you and ask that you get involved in our mission and consider volunteering with the organization, if that's through community educator, or maybe as a support group facilitator or ambassador, maybe becoming involved as an Alzheimer's Association advocate and speak out on behalf of the needs and rights of those facing Alzheimer's and all dementias, getting involved in clinical studies or trials, checking out Trial Match, which is our matching service for those trials and studies at alz.org Trial Match. And so you can find a lot of these resources again at our website, or if it's easier to give us a call, you can always call again that toll-free helpline. You can also get involved with the Walk to End Alzheimer's either by creating a team, or maybe next year you want to get involved as a committee member. So we would truly appreciate and ask for your help and support get involved as a community member and make a difference to your own community. So again, I'd like to thank you and thank the Stanislaus Healthy Aging and Fall Prevention Summit for inviting us to provide this wonderful, very brief introduction to Alzheimer's, and Dr. Dazan and her team from Kaiser Central Valley. And on your screen, the last screen here, if you have questions, you can always call our helpline, again, at that toll-free phone number on the screen, 1-800-272-3900, or check out our website at alz.org. And just thank you so much for your time today and your interest in learning more about Alzheimer's disease and other forms of dementia. So again, thank you so much for listening. Have a great day. Please take care and stay safe. Thank you very much.